When is a prenatal breastfeeding consult a good idea? Hi, I am Cindy Rubin. I am a pediatrician and breastfeeding medicine specialist and fourth trimester care doc in the Chicagoland area. So prenatal consults can be very, very helpful and important. And honestly, I recommend one for everyone. A lot of the time, the doctor who's managing and following you for your pregnancy, midwife or physician, may be very, very busy and not have time during those appointments to really go over things, and may not have the training to do it either and feel comfortable doing it. So finding somebody like a lactation consultant or possibly a breastfeeding medicine specialist can be really, really helpful, even with no history of problems or worry about having problems. Just learning a little bit more about how those first days usually go, how you can be prepared for it, what to expect, what not to expect, just to get you a little bit more informed, which can be really, really important and empowering for you and lead to a better experience. But some people really could benefit specifically with a breastfeeding medicine consult, and those are people with certain risk factors for having problems. So one is having had problems with another baby with breastfeeding, whether it was low production, high production, recurrent mastitis, whatever that problem may have been. If you had problems before, consulting with a physician to figure out maybe ideas about why it happened before and things that can be done differently this time to maximize your chances of those problems not happening. So history of problems, but also there's certain medical conditions that a pregnant person might have. So diabetes, underlying or gestational, hypertension, underlying or gestational, really any chronic illness in the birth parent could be problematic. Being an older mom, so over 35 years, even if you had a good experience the first time and you were a lot younger, if you're significantly older now, things could be a little bit more difficult. So history of breast surgery, if anybody's ever told you that your breasts aren't quite shaped the way that most people's are. I mean, breasts are all different and nobody's going to be exactly the same, but there's specific things that can make people a little bit higher risk. Anybody with a history of infertility or infertility treatments. So that is a really big one that it's really helpful to get a breastfeeding medicine physician prenatal consult to work on how to improve your chances of your breastfeeding journey looking the way that you want it to. I know I'm missing out on things, but those are some of the big ones, reasons to get a prenatal consult. If you are looking for that, if you fall into any of those categories, then please reach out to me today if you're in the Chicagoland area and we can set something up. Have a wonderful day.